Britain today, the public sector is bigger than the private sector. For the real productive economy to thrive, it must be released from the burden of paying for Britain's supersized state. But how?
Now, we're often told we can't possibly cut public spending because it will affect frontline services. Let's see if it's true. Here we have a vessel that represents the public sector. Remember, now we have almost 7.5 million people on the public payroll. How many frontline service workers do we get for our money?
According to the Office of National Statistics, there are now 196,000 policemen and women in the UK, though they complain that much of their time is spent filling in forms. We have 500,000 nurses, though the official figure also includes nurses working in private hospitals. The biggest group is the teachers. We have 962,000 of these, although again the official figure includes teachers working in private schools. There are fewer doctors, only 216,000, again including doctors in private hospitals. And then we come down to much smaller groups, like firemen, of whom we have 57,000, and prison officers, of whom there are 48,000. Add all these frontline workers together and you get just under 2 million. Though remember, this figure has been inflated by including many teachers, nurses and doctors who work in the private sector.
Now, I'm sure there are many worthwhile jobs we haven't included.
But 5.5 million? That's almost twice the number of people who work in manufacturing. What do they all do? The trouble is, it's not always clear from public sector job titles what the jobs involve. We decided to look up some real public sector jobs and then ask a panel of celebrities to guess what they were.
Is it a job involving a product or manufacturing anything?
No.
Do you work with tools?
Yes.
With a hammer?
No.
Stapler?
Yes, I do.
I think I've got it. Are you a community space challenge coordinator?
Yes, I am.
Person-centered planning facilitators and corporate strategy performance advisors, overview and scrutiny managers, and climate change program support officers.
Do you liaise for a living?
Yes.
Do you coordinate?
Yes.
If you didn't do your job, would anybody notice?
Oh, yes. In the private sector, if you really fail and are doing nothing useful, nobody pays you anything, nobody buys your product or service, and you go bust, and that's that. But nobody goes bust in a civil service or a public service like that. They just stay around being futile.
You're not a pigeon fancier, are you? They're not pigeon, birds, in those things you were shaking.
No, no.
Are you connected with the community in some way?
That is part of my job, yes.
If you're a private company and you employ vast numbers of people filling in forms and measuring things for no apparent purpose, you're going to go bust, because some other private company will be able to produce their product cheaper by not wasting all of that money on bureaucrats and form filling.
Do you counsel other councils about how to counsel councils?
No.
Do you consult other consultants at other councils about how to counsel other consultants at other councils?
Yes.
There is none of the tension of, well, does the guy deliver? Does that woman deliver? Or is she just waddling in, sitting her fat backside on a chair, moving around a bit of paper and going on?
Are you a community management engagement counsellor?
No.
Are you a community engagement counselling manager?
No.
Are you a consultant management engagement community expert counsellor?
No.
Are you a consultation and communities engagement manager? What is that?
When a private company is rubbish, it goes bust. But when a public body is rubbish, it expands. To fix our state education system, for example, politicians have launched a bewildering number of schemes. Early learning partnerships, parenting early intervention pathfinders, learning agreements and excellence hubs, learning outside the classroom, the framework for personal learning and thinking skills, Train to Gain, the Children's Plan, National Skills Academies, Numeracy Task Force, and so on and so on. Each one adds a new layer of bureaucracy, another quango, another set of reports and targets and reviews. Each one merely advertises the failure of the last. So on top of nurses, we have integration governance managers. As well as policemen, we have community safety performance managers. As well as teachers, we have early years inclusion facilitators. We have known ever since the Soviet Union that state monopolies are hopelessly bureaucratic and wasteful, that the goods and services they deliver are rotten and insufficient, that their customers are powerless and treated with disdain. And yet, in Britain, we have state monopolies in key areas like health and education.
The problem that you have with state providers, especially monopoly providers, if it's a state monopoly, is you deprive the individual citizen of choice. And one of the most powerful things you have if you are buying a product or service is choice. If you don't like this cafeteria, you can go to the one down the road because it's cheaper or nicer. If you don't like that restaurant, go to a different restaurant.
We are used to the idea that government prevents monopolies by private companies. There is legislation against monopolies by private companies.
Because we know that monopolies are a bad idea.
Because the state knows that monopolies are a bad idea. At exactly the same time, it insists on monopolies in education and health.
If you've got a state monopoly provider, you haven't got that choice. You queue up with everybody else and take what you're given and say, Oliver Twist-like, please sir, can I have some more? And if you don't have that consumer pressure, which you don't with state monopolies at all, then expect bad results.
James Bartholomew has spent the past decade studying Britain's state sector. As he points out, the biggest state monopoly outside communist China is the NHS.
Monopolies tend to do badly, state monopolies tend to do worst of all. We've now become one of the, if not the, worst healthcare system in the advanced world. Worst in pretty well every respect you can think of. We have fewer MRI scanners by far than average. We have fewer beds. We have fewer acute hospital beds. We treat fewer people with fewer cancer drugs and we give them less of them. When they go to their doctor, they don't realise that they're being diagnosed late, that they're being treated late, that they're getting a poor rate of radiotherapy, that they're getting out-of-date cancer drugs. They don't know this. They're innocents, many of whom are dying without knowing it's the fault of the NHS.
I've come to a health tourism show in Olympia. In these days of cheap travel, it's easy to hop on a plane and head abroad for your cancer treatment, say, to a country with much higher cancer survival rates, in hospitals that look more like five-star hotels, and all for little more than the cost of a holiday.
See you again. Bye.
Today we have Saturday, okay, and if a patient is coming here, British patient is coming, I have a serious problem, this and this and this, he can come on Monday and we're going to start immediately.
Does the NHS go to Germany trying to find patients? Do you find many patients wanting to come to England for treatment?
I think Germans would not go to England for treatment, no.
The NHS is the most monopolised state provision in the advanced world, and it is the worst system in the advanced world, the least successful system in terms of treating people well, and indeed treating the poor. So it is the most state-controlled and the worst. There is a connection between these two things.
People say we need a state health system in order to provide healthcare for the poor. Is that true?
In Germany we have a health insured system.
So all Germans must have health insurance?
There's a law that everybody who lives in Germany, not necessarily Germans, but everybody who lives in Germany needs to have health insurance.
What happens if they're poor and they can't afford it?
The state is paying the health insurance. Even if you're poor, unfortunately you get sick, yeah, and then you get the medical treatment, of course, yes.
You don't need to have a nationalised monopoly to treat the poor. They're treated in France, they're treated in Germany, in Italy, all around the world. Advanced countries look after the poor. You don't have to be a state monopoly. You can have an insurance system. That's become the norm in Europe.
The idea that we need state monopolies in order to look after the poor is obviously untrue.
We make sure poor people in Britain have shoes and clothes and food, but we don't have state shoe shops and state clothes shops and government canteens. Can you imagine how awful that would be?
In fact, in our state health and education system, the poor do especially badly.
It's the articulate, pushy middle classes who manage to see the consultant and get their kids into the one decent state school in the area. Excuse me, you put skimmed milk in my latte. People say you can't possibly privatise health and education because private firms will be in it to make a profit. But we're surrounded by wonderful things made by companies who need to make a profit. Do we say, we can't have a washing machine made by Bosch or Zanussi because they make a profit? Much better to have a washing machine made by the state. Let's not get a Toyota, they're in it for the money. Much wiser to wait in a queue for a government-made Trabant.